coolest parts of the face is this structure right here, the lips. And as you go through social media and probably everything on the internet, there's a lot of buzz about lips. Big lips, small lips, red lips, so on and so forth. Hi, I'm Dr. Athré. I'm a double board certified facial plastic surgeon based here in Houston, Texas. And what I would like to talk about is lips. Not just sticking filler in lips, but how do you truly rejuvenate the lips? So before we get started on this, let's talk about why the lips are so important. So first of all, from a perspective of just the way that the face is, the key integral components of the face are the eyes and this area right here. So as I'm talking to you, due to the fact that my face is relatively pretty symmetric, your eyes are just really bouncing back and forth between my eyes, my mouth, my eyes, my mouth, my eyes, my mouth. So this area tends to draw a lot of attention. We even see this as surgeons because when patients come to us and they say, I want rejuvenation, the top areas that they look for rejuvenation is somewhere in this box right here and somewhere in this box right here. These are the most common areas that patients ask to be rejuvenated. And the primary reason for this is they see themselves that these are the areas that draw attention on one's face. Now, there's been a lot of buzz recently about big lips. I think the moment Angelina Jolie jumped on the scene, lips became the thing. Add that to fillers and the Kardashians and so on and so forth. There's been a lot of buzz about lips. So what is it about the lips and aging? So your lips age just like tissue everywhere else on the body. So as we all age, we've talked about this loss of volume, loss of elastin, loss of collagen. These things happen in the lips too. And how we actually see this is as follows. One of the things we see is we see the inturning of the lip. So the amount of red show of the lip becomes less. The distance between the end of the nose and the top of the vermilion border here also increases. Finally, we lose a lot of volume and red show on the bottom of the lip. And I'm using my words very, very specifically. I'm using this idea of loss of red show as opposed to using the word projection. In my eyes, projection is how far the lips stick out from the face. Red show is how much of the red is exposed. So when you see a person who has had this aging process kind of go down the road, they have a long area between the columella and the lip, and they have very little red show, and they show up and say, hey, I'd like some lip fillers. Most of the time, this person is going to end up looking like Daffy Duck. The reason for that is fillers do not have the capacity to roll the lip out. Their amount of capacity to essentially roll out the red section is limited. Their capacity for projection is far more. There are tips and techniques to help roll out the red section, but overall, someone who has a very long columella to cupid's bow distance cannot really be fixed with adding volume to the lip. The volume is just going to make them look like Daffy Duck. So how do we repair this? So we've now addressed the fact that the lips are a very integral portion of the face. And as we look at facial rejuvenation, and you've seen my videos on YouTube, you're starting to understand my overall philosophy. When we rejuvenate the face, we don't rejuvenate the face based on individual sections. We look at the face as a whole. As we're looking at the face as a whole, we have to recognize that the lips and the perioral complex are part of this whole. So I can do a facelift, which addresses the cheeks, the jaw, and the neck, and get you a very rejuvenated look. I can add volume to these areas to further enhance that look. If something is not done in this area, this will not be in balance to the rest of the face. This is where we look at the art and science of lip lifting. Lip lifts have been around for a long time. They were really hot in the 70s. They lost a lot of their attention, and they're making a resurgence back again. Lip lifts are very, very important in the toolbox of rejuvenating this area, because you can very accurately reduce the distance from the columella to the lip and enhance the amount of the red show. There are different types of lip lifts. So let's take a look at the upper lip for one. One type of lip lift of the upper lip is called a V to Y advancement. That is essentially done on the inside of the lip. What that can really do is enhance the plumpness and the red show of probably the central 40% of the lip. So someone who has a very decent amount of volume and redness on the lateral portions and is really just looking for a little bit more volume in the central portion may benefit from this type of lip lift. The more traditional lip lift is done by an external incision that's right underneath the nose. That type of lip lift is very important for addressing about the 60% of the upper lip. It's really not so good for addressing the corners of the lip. So if someone has a lot of loss of volume of the corners with downturning lips and a very thick crease in this area, not only may a lip lift need to be done across here, but also on the edges to lift the corners of the mouth, so therefore they don't have that downturned, sad appearance. Now, for the bottom lip, you've got a couple of options as well. Most of the time, the bottom lip does not lose as much volume as the top lip. So in the bottom lip, you may be able to get away with another V to Y advancement, which gives you a lot of volume and turnout of the middle, probably 40 to 50%. All of these are surgical procedures that we're using to describe how to rejuvenate the lip. Now, we can add to that by adding some amount of volume to the lip. So I've already explained in prior videos that I love using facial fat transfer. As I use facial fat transfer, I can also use some of this fat in the lip. Now, it's important to recognize that fat doesn't normally live in the lip. So if I take a normal lip and cut it up, there's not a lot of fat tissue in there. So we're putting fat tissue in a place where it's normally doesn't exist. For that reason, I like to use either microfat or nanofat or a combination of both to add a little bit of volume, and using the nanofat with stem cells to really help regenerate some of the tissues of the lip. So long and short of this talk is as follows. As we look at facial rejuvenation, and we recognize that facial rejuvenation is not a set of isolated procedures, but rather it's like painting a picture where everything is in harmony with everything else, one cannot forget the lips. The lips are a very important portion of the face, and putting the lips in balance with the rest of the face and rejuvenating them the same way that we rejuvenate everything else is important and lends to the harmonious look of the face. A couple of caveats to this, however. I do think that first of all, there are cultural differences, cultural/ethnic differences on what patients like and what anatomically they have. So for example, patients from certain portions of the world definitely have much fuller lips, and they tend to like fuller lips. Patients that are Caucasian, for example, tend to have thinner lips and like a less full appearance to the lips. So that's one part of it. A second part of it also is there are geographical things that kind of affect this. For example, I've noticed that patients that are from California and such tend to have a look that they like. Their aesthetic is for a much fuller lip. Patients in the South, for example, here tend to have an aesthetic that is a little bit more on the natural and less full side. So as we talk to patients, I tend to ask them what their aesthetic is, what they like, and also look at photos of themselves at earlier points in time to get clues into what they look like so that we can find something that really matches their overall anatomy as well as the aesthetic that they feel is beautiful. I really hope that you found this little chit chat on lips interesting. I think it's something that not a lot of people talk about, but it's very important in the overall rejuvenation of the face. If you found this content interesting, or you learned something, or you want to see more of this content, please give us a like and a subscribe. It really gives us some pointers onto creating new content and finding out what people find is interesting out there. Again, if you have any questions, please hit them down below in the comments section and we'll try to answer them as soon as possible. Till then, I'm Dr. Athré, Athré Facial Plastics, Houston, Texas.